Good morning, Flagstaff Clinic. Nicola speaking. How can I help?
The Flagstaff Dental Clinic in Colchester treats more than 4,000 patients each year who are referred by their dentists for all aspects of minor oral surgery, including surgical extractions, third molar removal, apical surgery and comprehensive dental implant treatment.
We accept patients on referral from general dental practitioners, so for virtually all patients are sent to us by a dentist rather than contacting us direct for treatment. In doing this, we're specifically undertaking oral surgery or implant work on request from that practitioner. If we need to do any variation in the treatment plan, or we think there are some other issues that need consideration, we liaise closely with the referring practitioner and communicate with them about the treatment that we think is appropriate to carry out. All patients have a consultation in advance of the treatment being carried out. We'll verify the treatment being carried out. If we've got any queries, we'll of course contact the practitioner. And the pathway for the patient is such that the person undertaking the consultation here at the clinic is almost always going to be the same person who carries out the actual surgery. And a small team of dedicated surgeons and anaesthetist will carry out this minor oral surgery or implant work, and most importantly, on completion, we'll send them back to their own dental surgeon with a written summary of the treatment carried out.
The clinic has been established for more than 35 years, and more than 300 dentists from across Essex and Suffolk refer both fee-paying independent and also NHS patients.
They are very good at taking teeth out, I must say. Any difficult extractions, any wisdom teeth, any surgical extractions, any nervous patients, they do the job very well, efficient and professional.
The Flagstaff team includes specialist oral surgeons, dental surgeons, anaesthetists and nurses.
The important part, of course, is the patient, and the patient will benefit if everybody understands what we're trying to achieve. So an important part of that is the dentist, who knows the patient the best from everyone, and as long as we make sure that they understand what we're trying to do and we understand what they want us to achieve for their patients, then that means that the patient is at the centre of care and that hopefully we get the optimum outcome for them to get their treatment provided.
Once a patient is referred for oral surgery or dental implants, they attend an initial assessment where the options for treatment are explored. A written plan is then produced and, where appropriate, discussed with the patient's dentist.
I'm a specialist periodontist and an implant surgeon, so all the patients who require, for instance, sinus lifts or any bone grafting are referred to the clinic. And then once that's been done, I would carry on with the placement of the implants.
For implant cases, once the implant treatment plan is accepted, there is a full diagnostic workup, including study models and photographs, together with a working template. And for those dentists wishing to carry out the restorative aspect of dental implant treatment, there is a very close liaison about the treatment plan.
When patients are referred here, a lot of the patients are quite anxious about coming to a new place. So it's our job to make them feel comfortable. And part of that process is, if we maintain a good relationship with the dentist, I think the dentist will make them feel comfortable about coming here in the first place.
I had problems with my front teeth. I had them over the years. I had them all crowned, and it was getting to the stage where they were regularly falling out. I was losing a crown. So my dentist referred me to Flagstaff for some advice on implants, which was I had to consider for quite a while, because obviously it's quite an expensive exercise. But I came and saw the dentist here, and he confirmed that my mouth was suitable to have implants on my front teeth. So I went ahead. And I was very pleased with the result, yes.
Whilst the actual dental implant surgery is specialised, many of the restorative aspects of treatment can be undertaken by the patient's own dentist with appropriate training.
We do actually run an audit regularly for patient satisfaction, and I can say that for the last 10 years we've been getting busier every year. We do treat over about 5,000 patients a year, so it's important that our patients are happy, and then they go back to their dentist and they tell them that their experience in this clinic was quite nice, a very positive experience, and that's important for any referral practice.
The way they did it, I mean, was brilliant. They're very professional, very caring.
I have had implants, and the experience was very positive. I didn't know what to expect, but it was all very straightforward and pleasant.
The Flagstaff Clinic also provides a free study club for referring dentists, teaching how to manage the restoration of simple implant cases, such as crowns, small bridges and simple overdentures, and provides training in the basic techniques required for this restoration work. More information about the study club is available in a separate video.
Whenever I send a patient, I give them my personal recommendation that if I was going to have a tooth out, I would actually get Azhar to take it out for me.
It provides an excellent service for people wanting oral surgery or simple routine treatment under sedation.